When people think about the dangers of drugs, something explicit usually comes to mind. They think of harder drugs like heroin, meth, and cocaine. Sometimes they even think of something more illicit and acceptable, such as alcohol or over-the-counter medicine. What few people think of when they think of a drug is caffeine. It is only a mild stimulant and it is not known to have too many severe effects or severe withdrawals. Despite this, it is still a mildly addictive drug that can cause health complications and increase risks of other chronic diseases should it be taken in excess. That being said, caffeine is one of the most used and abused drugs in the United States. As a mild stimulant, caffeine is known to increase a person's blood sugar and blood pressure. Coffee is the most commonly consumed caffeine product. Coffee alone can result in stomach irritation, acid reflux, and heartburn. If taken moderately, these symptoms are minimal. It is recommended that caffeine intake should be limited to only 300 milligrams per day to be considered safe for adults. Caffeine, however, is found in many consumable products other than just coffee and tea. They can be found in products such as chocolate and baked goods. Because of this, people typically wind up consuming more caffeine than they think. Out of over 300 million people that live in the United States, 90% of people consume caffeine each day, and half of those people wind up consuming over the recommended 300 milligrams. Knowing that many people unknowingly consume too much caffeine, what risks does the overconsumption of it hold? One concern is that it can increase the risks of hypertension and diabetes, especially for those most at risk of developing these conditions. In smaller amounts, caffeine can cause short bursts of high blood pressure, but little permanent damage. However, too much caffeine can have longer-lasting effects on blood pressure and decrease the strength of blood vessels. Caffeine is also problematic for people who are pre-diabetic or are part of a high-risk group because caffeine products are known to cause sharp elevations in blood sugar. Groups at the highest risks for these complications include African Americans, Mexican Americans, and American Indians. Aside from these risks, excessive caffeine consumption can cause incontinence, reduce fertility rates in women, and increase risk of miscarriage if high amounts are consumed near conception. On top of this, too much caffeine intake over the recommended amount can greatly increase anxiety and lead to insomnia. There are also a few concerns for college students specifically. College-aged males are the group who consume the most energy drinks. The problem with these drinks is that they have stronger symptoms than just a cup of coffee alone. One can of an energy drink can easily have over 500 milligrams of caffeine. And as the popularity of these drinks rose, so did the number of emergency room visits due to caffeine-related problems. In some extreme cases, they have been known to cause death by causing the user to suffer from cardiac arrhythmia after 1 or 2 cans. At the same time, college students are also those who are most likely to mix caffeine, specifically those found in energy drinks, with alcohol. This can be highly dangerous because the caffeine can prevent a person from realizing how drunk they really are, and it increases the chances of alcohol poisoning. Although caffeine is a relatively safe drug if taken within a 300 milligram a day range, it still causes mild addiction and withdrawal symptoms. As far as the body goes, the brain begins to grow more adenosine receptors when introduced to caffeine, which is also what causes tolerance. Withdrawal from caffeine can result in headaches, depression, sleepiness, and lack of concentration. These symptoms are usually short-term and disappear within a few days. However, as of 2013, caffeine dependency and caffeine withdrawal have been added to the DSM-5 as a mental disorder.
No more caffeine for you.